first I would like to call upon Dr. Niranjan to give his talks on the basic differences between the various types of autoclaves, their pros and cons. So if you're a person who's starting your practice, how do you go about to choose your autoclave is the basis of his talk. Over to you, Dr. Niranjan.
Thank you, Kumaran sir, for this wonderful opportunity to be part of this wonderful team of IC. Can I have the slides, please? No, this is not the one. Dr. Niranjan Karthik, who last one. Right. So, yes, so we're going to talk about the heat to prevent defeat in the war against microbes. So let's briefly discuss about the pros and cons of different autoclaves. So we must remember that autoclave is not like any other machine, but it's actually a way that we promise a component of safety to our patients. So the sterilization process itself is broad and wide. So there are multiple methods, and we're just going to focus on a small aspect of it, but a very crucial one as far as our practice goes. So of all these different types, chemical, radiation, thermal, our focus is today going to be on thermal sterilization. So like we discussed, these are the multiple methods of physical methods of sterilization, and amongst them we are going to discuss in detail about heat or thermal sterilization. So again, that's further classified into moist heat and dry heat, and autoclaves belong to the category of moist heat sterilization. So what is this autoclave? Autoclave is basically literary meaning is self-locking device. So in Latin, and clavis means key, and auto is automatic. So it is a self-locking device, and it was first invented by Charles Chamberlain in 1884, and the rest is history. So it has been an unparalleled or a very crucial component of practice in maintaining and maintaining safety and quality. So we'll just deal with principle of autoclave in brief. So remember that the boiling point of water is directly proportional to the pressure. So here we are going to play with two main components, the temperature and the pressure, while the volume remains constant. So what we try to do is, we try to maintain the pressure inside the chamber to a certain extent and try to increase the boiling point and the thermal energy that is transferred. So the mechanism of sterilization, how does it help? So there is denaturation of critical protein and nucleic acids within the cell walls of the different microbes, which brings about the killing process and hence helps in getting rid of them in the right time. So broadly, there are three phases of sterilization, and it is very crucial for us to understand this because it has very much practical implication in our day-to-day practice. As you can see, in the first phase there is an increase in the temperature, second phase is the plateau phase, and last but most underestimated part is the third phase, where we often fail to wait till this third phase kicks in and then do the removal of the gadgets, and hence this phase is very important in our clinical practice. So why are we so bothered about steam, or why are we so interested in steam? It's very important to remember that at boiling point, the heat that is transferred, there is an extra component of heat and thermal energy which is present in steam that's not present in water. So at same 100 degrees, steam has much more heat energy compared to boiling water, and hence steam is very efficient in killing the organisms. So what are the parameters that we need to be concerned about? This is TPT, that is temperature, pressure and time. So pressure is 15 psi, temperature is to be maintained as 121 degrees, and time for about 30 minutes. Right. So it's important to understand the different parts or the anatomy of an autoclave. We've done enough anatomy of the eye. So now it's time to branch out and know a little bit about your machines as well. So it mainly has the chamber, which is where we place the equipments, the heating elements, the drainage system which takes care of the excess of water that comes out of the machine, the control panel where we set in the temperatures, etc., the door lock, the water reservoir, the vacuum system and other locking features. So now coming to the heart of our topic, the different types of autoclaves. As you can see, they come in all shapes and sizes. So what is suitable for us and how do we go about choosing them is what we're going to talk about. So broadly dividing them, we have three different methods, and the most common ones are the vacuum and the gravity method. So gravity method uses gravity to replace the air with steam. What we need to understand here is the air inside the chamber has to be gotten rid of, and we have to introduce steam. So how do we go about doing it is what this broad classification is about. So using gravity as a tool to do it gives us this gravity method, whereas the vacuum method, there is active pumping out of this air followed by replacement with steam. Now that is what makes this vacuum method special. And thirdly, using liquid. Liquid method is not so much of common use. Mainly it is the vacuum and the gravity method. So when you talk about gravity, you have to talk about it from in terms of height and in terms of verticality. So the vertical autoclaves work in the principle of gravity displacement, which is used to process lab media, pharmaceuticals, and some amounts of medical waste and non-porous articles. Remember, how do we remember so many things? It's very simple. Surfaces which require direct steam contact, they have to be used in vertical autoclaves. Remember that there is prolonged penetration time, and hence sometimes what we need to remember, the air that I spoke about that needs to be eliminated may not be completely eliminated when you depend only on gravity. Remember, gravity, you are talking about a passive energy here, so the incomplete air elimination is a very crucial part. Secondly, it can be used for sterilizing hollow cannula tubing. It can't be used for it because it's very difficult to calibrate it. And lastly, like I mentioned, it leaves behind residual air. So let's discuss the pros and cons. Relatively low cost, ideal for sterilizing solid. Remember, solid instruments, and suitable for small to medium sized loads. But like I mentioned, cycle time is long and can cause damage to delicate instruments. Slide change. Let's move on to the next type of autoclave, which is the horizontal autoclaves, which is vacuum assisted. So this is the basic principle of vacuum. So what we do, we try to pump in, we try to create vacuum by pushing out the air, and steam is actively pumped in against the closed valve, and that is how we develop the pressure that we spoke about in the previous slides. So under this particular category of vacuum assisted, there are different types. First is the B type, which is the prototype, where there is positive pressure displacement. Separate steam generator. Note this point. A separate steam generator feeds the main body of the autoclave in the system. And remember that it's faster because it is positive pressure. Whereas the N type is the negative pressure, has a steam generator and a vacuum generator, and this is where it first sucks out the air inside and then the steam starts rushing in. So these are the different models. And remember, usually class N is meant for solid ones, whereas class B can be used for hollow instruments as well. And an added advantage of class B is it is available multiple shapes and sizes. It can even be a tabletop instrument, thereby occupying relatively less space compared to the other types. So this is about the pros and cons of class B autoclaves, which we already discussed. Then moving on to ETO sterilizer, what we need to understand here are the pros and cons. Remember that which cannot be sterilized with heat and moisture, which are very sensitive to it, we prefer ETO stabilizer, can be used to sterilize large and complex instruments including medical devices, and the cost is relatively low. But again, like we discussed in the gravity type, the cycle time is long and requires prior ventilation to prevent exposure to toxic fumes. And next is the plasma sterilizer, which uses low temperature plasma to kill organisms. Like we spoke about the previous one, here also we have to consider instruments which can't be sensitized to or exposed to high temperatures for this particular method. So 35 to 50 degrees Celsius, and the advantage is it has a short cycle time, and the sterilization is quite effective and relatively environment friendly. But what are the difficulties here? There is limited load capacity, instrument preparation is quite tedious, and lastly the maintenance is quite heavy. It requires regular maintenance and cleaning for plasma sterilization. Right, so with all these different types, do we know at this point what is the type of autoclave we need? And that's where we're going to discuss the further slides. So remember that it should be something like a customized method rather than one size fits all. So what we need to know is what are our requirements, what are our demands, and accordingly choose the type of autoclave. So what are the questions or the checklist that you need to do or check before you buy an autoclave? First and the foremost is what is the size of autoclave I need? Secondly, what types of loads will I be running in my autoclave? These are questions that are personalized to each one's practice, so accordingly has to be answered. What is the steam source available for the autoclave? Remember, the setting up of an autoclave is not just the machine in itself. It's not like a laptop. It's something like a PC where you have to find out a plug point, you have to arrange your computer table, right? So accordingly, we have to prepare the inputs and the outputs of this autoclave as well. Do I have the right type of water available for the autoclave? How much floor space will it take up in my setup? What are the utility support required? And yes, this is important. Should I invest in water and energy saving technology? Because those are not light demanding equipments as far as your EB bill goes. How will I get the autoclave installed from the loading dock to its final resting place, right? And tech support available. This is very crucial because being an instrument that's used in our routine practice, it is bound to be, having regular maintenance, etc. What is the warranty? Are the replacement parts easily available? And like we spoke about CMC and AMC to prevent unnecessary expenditure on maintenance. Demo and staff training. This is very crucial because it is not something that everybody uses on a day-to-day basis. So it's very crucial to get somebody to give you a demo and train your staff in that. What is this? Where is it manufactured? And how many years have they been in business? This is very important because the better or the longer they've been in the field, they understand the drawbacks, they get the feedback from the doctors and work on it to give a better equipment. Does the manufacturer have a single expertise or single product focus? Because that makes things easier for us because they are focused on getting their instrument in this area more better. And lastly, do I want to purchase a new or a refurbished autoclave? So like we discussed, how do we decide on the size, type and brand? These are the certain important points that we need to focus on. Most important is the chamber size. And lastly, the second important is sterilization cycles. And last but not the least is price, including the maintenance cost. So we spoke about the water source. Remember, there are three ways of going about it. One is softened water, which is gotten after removing the hardness part using a filter. Then comes reverse osmosis, and along with reverse osmosis is the deionization process. So these are different types of water sources that your autoclave may demand in order for it to function properly. So next is two important aspects of this autoclave we need to know. One is the engineering controls and the administrative controls. Remember that engineering controls is how to operate it on a routine basis, right? Whereas the administrative controls is more about the emergency preparedness. Let's say it malfunctions or it doesn't work on one fine day when you have 10 patients lined up in your OT the next day. So how do you go about it? So these are the two important aspects that you need to look into. Next is the emerging trend is to reduce the human aspect of it and bring about more of an automation process in it so that the chance of error in human intervention is much lesser. And lastly, to give a rough idea of choosing an autoclave, for an ophthalmic use, ideal would be to choose a B class or plasma sterilizer. And lastly, the capacity should match the scope of your service and your practice demands. So invest in yourself. It's the best time you will ever make, best investment you will ever make, and the next best investment would be your autoclave. Thank you.
Thank you, Dr. Niranjan, for that wonderful lecture. Your 17 points of how to design on an autoclave was amazing. I think everyone should look into it. I now call upon Dr. Ravi Shankar to deliver his next talk. Before that, we will just ask a very small question. So, Dr. Nirmal, a lot of people who start their practice keep asking us, sir, I have a vertical autoclave. Should I go on to buy a Class B autoclave, or can I continue with a vertical autoclave? And the second question is the source of water. Can I use a normal distilled water or a RO water is enough for these autoclaves?
Okay, so let me answer your first question about vertical autoclaves. Vertical autoclave problem is we've been using it quite rampantly in almost all places. But in ophthalmology, we use cannulas and phaco tubings and vitrectomy tubings, which has long tubings and with narrow ends, with narrow lumens. So it's very difficult for the steam to penetrate inside. So we need to have a vacuum cycle so that the steam penetrates well and sterilizes. So the regular vertical autoclave, gravity place autoclave may not be able to do this and attain a proper pre-vacuum level. So that is the reason why we need a Class B autoclave. So even in the beginning, if you are in ophthalmic field, with involving tubings and cannulas, better to go for a horizontal Class B autoclave.
Okay. So about the water source, would you prefer distilled water over an RO purified water, or is there any particular specifications?
Ideal would be to have a distilled water, but if the procurement is difficult, then RO water will do. So it all depends on the water content and the salt content of the salt and mineral content of your water. So if it is can be treated and the mineral content salt dissolving mineral content can be brought down by any means, that well and good. But if we are a large institute, it's better to have a distilled water plant and use the distilled water.
So the other important point on using a distilled water is that the inside of your chambers we rarely clean. So when you use a distilled water which is free of salt, there is no salt deposition on the inside of the chamber. The longevity of your autoclave is more, and the coils also don't get damaged. So this is an important factor that it's always preferable to use a distilled water. There's a lot of calls on whether a plasma sterilizer has to be used, but we need to understand that the plasma sterilizers, there are two important roadblocks with them. One is the expense, and other thing is that the way they sterilize the hollow instruments is still in the developing. But the steam sterilization still plays an important part in most of the process because it is inexpensive